Welcome to today's VDO News. I'm Lily. Faster, more effective knee replacement surgery is now available in a Singaporean hospital with a new artificial intelligence algorithm. Developed by Alexandra Hospital in Singapore, the technology has reduced the time required for a total knee replacement procedure by half. An AI-powered algorithm is integrated into a robot software to determine the optimal positioning of implants in a fraction of a second. Robots are commonly used to make the operation more precise. Total knee replacement is among the most common procedures performed here, with about 6,000 such cases each year. While the accurate positioning of implants is crucial to the success of the operation, deciding on the optimal placement is complex due to each patient's unique bone and ligament structures. Currently, this is done during surgery, with surgeons manually planning and adjusting the positioning of the implants for the femur and tibia. Manual planning is a time-consuming process that takes around 15 minutes in the operating theater. Glenn Liao, a consultant with Alexandra Hospital's orthopedic surgery department, said the planning cannot be done beforehand, as current imaging fails to provide surgeons with details such as the full range of movement of a patient's knee. To address these issues, Liao developed the algorithm with the aim of making robotic total knee replacement surgery more accurate and efficient. The algorithm can compute thousands of permutations to determine the optimal implant positioning, accurate to within 0.5 millimeter and under 0.1 second. A prospective study of 67 patients who underwent robotic total knee replacements was conducted between November 2021 and December 2023, with 25 cases utilizing the algorithm. It found that 92% of the operations that used the algorithm were accurate to within 1.5 millimeters. The study also found that with the algorithm, planning during a procedure took about only 1 minute, while the process without it took more than 14 minutes. This resulted in a shorter surgery time of about 38 minutes with the algorithm and more than 73 minutes without it. Patients in the algorithm group reported higher satisfaction with their knee replacements due to better alignment and fewer complications. Thank you for watching. See you next time.